contrast media for CT in GIT. So, um, hello friends, let us now learn some important contrast media which are used for CT in the diagnosis of gastrointestinal diseases. So, contrast media for CT, the main reason for using this contrast media is to differentiate the normal anatomical structures. What are the normal anatomical structures and what are the abnormal anatomical structures or pathological structures should be identified with the help of this contrast media. So first it will help to delineate or differentiate the normal anatomical structures, and these contrast medias also help us to identify the pathological processes also. What are the pathological things that are happening also can also be identified with the help of this contrast media. Now, so thus using contrast media will help us to identify the diseases and make the diagnosis easily. So as a result, it is very important to use a contrast media for CT whenever it is required. Then, if you see in the CT, usage of contrast media, or actually before thinking about contrast media in CT, one and most important thing for diagnosing pathology is to distend the bowel. That means actually the many diseases of the bowel, if you see many diseases of the bowel, these many diseases of the bowel mainly occur through manifesting as thickness of the bowel wall. There can be either thickness of the bowel wall or some growth occurring from the bowel wall. Either the bowel wall is thickened or even the growth is occurring from the bowel wall like polyps. So most of the diseases of the GIT, like diseases of the bowel, are mainly because of the because mainly these diseases are arising from the bowel wall. So we have to study the bowel wall clearly. So in order to study the bowel wall clearly, first and foremost, the bowel should be distended. Number one, whatever you do, that is not important, but the main important thing is bowel should be distended. Okay, so to diagnose pathology, number one prerequisite is bowel should be distended. So therefore, we use a contrast agent. So a contrast agent which we use here, this will distend the bowel, and this will actually fill and also distend the bowel. So once the bowel is distended, then the wall of the bowel, that is the bowel wall, can be studied easily. So because of this distension, we can study the bowel wall easily, and thus we can identify or diagnose the diseases or pathologies associated with the intestine and intestinal wall. So when do you say that the contrast agent is ideal? So what is an ideal gut contrast agent for CD? For CD, the ideal gut contrast agent, number one, it should fill the entire bowel lumen. It should fill the entire bowel lumen should be filled. That means if this is the bowel lumen, then the contrast that we use, it should fill the entire bowel lumen. Second, it should be palatable, easily taken by the patient. It is non-irritating. The patient should not feel that it is irritating to the intestinal mucosa. It should be non-irritating to intestinal mucosa. It should be non-irritating to the intestine. Then fourth, ideal gut contrast agent should fill the entire bowel lumen. It should be palatable and it should be non-irritating to the intestine. Then it should pass rapidly into the GIT in such a way that it should pass rapidly in GIT in such a way that it will not produce any artifacts. Because if it produces any artifacts, then the main use of being a contrast agent to determine diseases is not there, and these artifacts might mimic some diseases, or they might be confused. These artifacts might be confused with certain diseases, and this contrast agent should not stimulate peristalsis also, because if it stimulates peristalsis, then vigorous intestinal peristalsis, if it stimulates, then the patient might develop pain and certain other features. So a contrast agent should not produce artifacts, it should not stimulate peristalsis. And the contrast agent should coat the gut mucosa. It should coat the gut mucosa so that the lesion of the bowel, if it coats the gut mucosa properly, then lesion is detected very well when it coats the gut mucosa. Then one more important thing is, if you use a positive contrast material, this positive contrast material will increase the attenuation of the CT. We have an attenuation value of CT for bowel lumen. So this increased contrast, this positive contrast material will increase the CT attenuation value of the bowel by at least 40 Hounsfield units. So it will increase the CT attenuation unit value of bowel by around 40 Hounsfield units. Then, so this positive contrast media, which will increasing this CT value by at least 40 Hounsfield values, it can be done by using a dilute solutions of water soluble media. We can either use dilute solutions of water soluble media, or we can also use dilute suspensions of barium sulfate. By using dilute solutions of water soluble media or dilute suspensions of barium sulfate, we can increase the CT attenuation value of the bowel by 40 Hounsfield units. Then, if you see the normal conventional barium sulfate which we can use, if we use this conventional barium sulfate suspension, actually this conventional barium sulfate suspension has a property of density. It is very dense. So because of this high density, it can result in steak artifacts. If we administer this barium sulfate suspension, conventional one, it will result in steak artifacts. So right now we are mainly using a commercially available dilute 1 to 2% of barium sulfate agents, with special suspending agents are used. With special suspending agents are being used nowadays for performing this contrast agent has contrast agent in CT. Okay, next. Now, one more important thing is a solution of 2 to 3% of meglumine diatriazolate. We have 1 to 2% of meglumine diatriazolate. This meglumine diatriazolate will increase the CT attenuation value of gut. It will increase the CT attenuation value of gut, and thus it is easier when the CT attenuation value is high, then we can easily differentiate between the surrounding tissues. So as a result, the better delineation or differentiation of anatomical organs can be identified by using the solution of 2 to 3% meglumine diatriazolate. But if you see, one important thing is the water soluble agents which can be used. These water soluble agents, definitely they pass through the gut rapidly. They pass rapidly into the gut or through the gut. Okay. And once they pass rapidly through the gut, this is a good feature. But these water soluble agents do not coat the gut wall. They do not coat the gut wall properly. And also these water soluble agents also have a poor taste. These have a poor taste also. And these water soluble agents, once they rapidly pass through the gut, they will reach the ileum, that is terminal ileum. And when they reach the terminal ileum, they become diluted. And thus they do not delineate or demarcate the small bowel, that to the distal part, do not demarcate distal part properly. Because by the time they reach the distal small bowel, they become diluted. Because if you see, if this is the gut, we have ascending colon, transverse colon, and we also have descending colon. There will be these loops, and finally we will have ileum. Okay, so if you see this ileum, by the time the contrast passes to all these loops, and finally when it reaches this ileum, obviously ileum, there will be some water which might reach into this lumen, and as a result they become diluted once they reach the terminal ileum. So this distal part of small bowel, which is nothing but the ileum, cannot be demarcated properly with the use of this water soluble agents. Now, so for better to make sure that the contrast agent will demarcate the organs properly, demarcate the anatomy properly, we can use some special techniques. In these special techniques, one, we can use a glucagon injection. A glucagon injection can be given to the patient, has 0.1 milligrams IV or IM we can give. This will actually reduces the gut motility, and because it reduces gut motility, it will also decrease the formation of motion artifacts. Motion artifacts which are developed will also be decreased by using glucagon injections. Then we have octapeptide injections can also be given. These octapeptide injections will they will briefly, not always, but they will briefly for certain amount of time, they stimulate the small bowel peristalsis. They briefly stimulate the small bowel peristalsis. Then if you see third, we have metoclopramide can also be given. This metoclopramide is a dopamine antagonist. It is given as 10 milligrams orally. We can give it. This metoclopramide is given 45 minutes before starting the CT. Before starting CT, this is given 45 minutes. And once we give metoclopramide, it will empty the stomach completely. And as a result, because it empties the stomach, okay, it will empty the stomach completely, and thus this will improve or increase the opacification of ileum, and thus the organs can be demarcated easily by using this metoclopramide. Then if you see for colon, this is for small bowel and stomach, good. Then what should you do for colon? For colon and rectum, we have to use dilute solutions of contrast media of around 1 to 2% of contrast media is used as enema. 200 to 600 ml of enema can be given to the patient. Now, recently we also have air contrast studies are also being started, where we use air as a contrast agent and we give air or pass air into the colon for studying the anatomy of colon and for studying the pathological processes of colon, and knowing what diseases or what is the diagnosis of the pathological condition which you see on the studies. Now, these air contrast studies are recently they have been the method of choice to evaluate the colon. In order to evaluate the colon, the method of choice is air contrast studies. Now, these air contrast studies are actually contraindicated in patients with acute diverticulitis we should not use. Similarly, if the patient has inflammatory bowel disease or in case of radiation proctitis, this air contrast study is not generally used. So these are the important things about the contrast media which are used in CT. So contrast media for CT are these all. Thank you.